Thank you, Christine. Good afternoon, everyone. Before I hand it over to Dr. Strang, I want to pass on our condolences as the province of Nova Scotia to the family who lost a loved one due to COVID-19. I say this every time, and it's because I believe it's so critical. Losing someone at any point is tough enough, but losing someone with the restrictions that we have imposed in our province and really across the country, it makes it even that much more difficult. We can't have the opportunity to mourn the way we normally would, or quite frankly, friends can't have an opportunity to come and provide support and care to the living. And it is an important part of that, but I want you to know that you are in our thoughts, and all Nova Scotia is with you. Dr. Strang.
Thank you, Premier. Good afternoon, everybody. I too echo Premier McNeil's remarks. My thoughts are with the family who continue to grieve the loss of their loved one, because we are unfortunately reporting the death of another Nova Scotian due to COVID-19. This death was a woman in her 70s with underlying medical conditions. She actually, from Central Zone, she actually passed away a number of weeks ago. Her death had been under investigation since then to determine if it was actually COVID related or not, and we've now got the information to make the conclusion that this was actually related to COVID-19. We now have 62 Nova Scotians who have died due to COVID-19. Along with that, we're reporting one new case of COVID-19 and bringing the total number of confirmed cases to 1,060. We do know that this new case is a close contact of a known case, which helps us give us assurance of we know where the person was likely exposed. We have had a few days in the past week with low to no cases, so the news continues to be good. But I want to caution everybody about reading too much into a single day or even a few days. We know we have to watch the epidemiology for a minimum of 2 weeks to understand any one situation. And we have to continue through June and into the summer, even as we reopen things, continue to have a strong focus on easy access to testing, low threshold for testing, and strong follow-up of any positive cases, and an overall strong focus on ongoing monitoring of the epidemiology. We know that the QE2 lab, they processed 578 tests yesterday. We have one licensed long-term care home that has active COVID-19, which is Northwood, as people know, and now we're down to one. They have a single resident who is considered an active case. So we continue to make progress at Northwood. Again, while all this is good news, things are trending in the right direction. We have to be careful. We need to be continuing to take a very measured and cautious approach as we move into recovery. I need to emphasize that anybody feeling unwell that should actually think about going to the 811 online assessment. We have a broad range of symptoms now that if people have those symptoms that are new or worsening of chronic symptoms, then they should actually be looking to get a test for COVID-19. We know that COVID presents in quite a diverse manner in a number of different symptoms. So if you're unsure at all, if you're feeling unwell, we really encourage people to do that 811 online assessment, and you'll get further direction about testing from there. I know there's been a number of questions over the last few days about data, and we have been working to resolve those, and we have the solution. And so I want to just help people understand why we've had some of those challenges. At the very beginning of COVID, we knew we needed to get immediate information that we could report publicly very quickly, and we used our lab information, the number of cases coming from our lab. At the same time, we were in the process of finalizing the implementation of our public health information information panorama, but the lab information had not yet been integrated into that panorama system. So because of the time pressures and the workload around dealing with the peak of COVID, we weren't able to do that integration, and because we were having to use two different data systems, that gave the opportunity for some discrepancies to arise. We have now been able to finalize the integration of the lab information into Panorama, and the good news of that, we are the first province in the country to actually do that full integration of lab information of notifiable diseases being fully integrated into the public health electronic information system. So that is the good news. It also means that Panorama is now our single source of data, and starting tomorrow, we'll be able to reconcile some of the inconsistencies that people have seen, and starting to produce that what I call the gold standard of accurate information coming from Panorama. So that will be starting tomorrow. I understand that people are eager to make plans about summer vacation. School, at least for students, officially ended last Friday. People are thinking about being able to get out and about more as we move out of the first wave of COVID. And so we need to talk, I want to talk a few minutes about travel, that it certainly is the point now where we can, within Nova Scotia, that people can travel more freely. It's important we understand that there are going to be many challenges to our local economy and our tourism industry. So this year is going to be a year of really, we encourage people to actually do your vacation at home within Nova Scotia, travel around the province, doing that safely, but at the same time supporting our local economy and in communities around the province. We know that many businesses that were opened on Friday are just starting to open up. That it's important that we support those businesses, but it's also important that we understand that Friday was a very big day. We've by opening up a lot of things on the business side, we have necessarily introduced some increased risk of COVID-19 recurring. So we need to watch things over the next couple of weeks. We have had on 2 consecutive weekends, we've had a single case where we're not clear on where the person would have been exposed, and therefore we have to conclude there was some unknown exposure in the community. So there are still some signs of community transmission in the recent past, and so even though our numbers of COVID-19 are low, that emphasizes the need for us to continue to take a cautious approach. We'll continue to watch the epidemiology closely and monitor things go out throughout June. We're already starting to put together plans to present to the Premier about if the epidemiology is sustained, what the next step in our reopening and our recovery could be, and that hopefully all things will go well, and we'll be able to have a further opening as we enter into in end of June, early July, and give more opportunities for people to do a variety of things around summer vacation. But for now, while we work through that, there's still lots of opportunity. People can go to their cottage, go fishing. Private campgrounds are open next June 15th. Our public campgrounds will be open. Get outdoors. People can go ride a bike, go for a hike. We have restaurants open. People can go with people in their household or their household bubble, going out for dinner. It's just important that people still, while they're doing all those things, remember about maintaining social distance, about people who are not in your household or household bubble, careful hand washing, and especially if people are feeling unwell, just staying home until they either have gone through the testing if appropriate, or if they're feeling better. So while we're have more opportunities, while we're encouraging people to get out and be more active, it's important that we do that safely. And I'm going to end by, I had some conversations yesterday and today with colleagues in government who are involved in the various inspections, whether it's from an occupational health and safety inspection, alcohol and gaming, who were out on the weekend in bars and restaurants, and they're consistently what they said is that they were impressed with how thorough the plans that businesses have put together to open, but to do open safely, and and so we're very encouraged about all that, the commitment on the business sector and their work to implement safe plans. But I want to remind people that while that happens, it's equally important that as Nova Scotians we collectively do what we need to do. While we have opening up safe environments, whether it's retail environments, work environments, community opportunity environments, they'll only work if as Nova Scotians we go there and we do what we need to do around maintaining social distance, looking after one another, making sure that we're not overcrowding, making sure we're following the rules about staying within our households or household bubbles, focusing on hand washing, staying home if we're not well. It's this collective effort. Businesses, organizations doing what they can do, each Nova Scotian and Nova Scotian family doing what we can do, and it's a collective work that will provide this appropriate level of safety while we work to reopen and recover both our economy and our communities. Premier.
Thank you, Dr. Strang. Well said. Chrissy will be happy to answer any questions.
There will be one question and one follow-up for reporters on the line in the time that we have allotted for today. First question goes to Jesse Thomas with Global.
Thank you. The question is for the Premier, and it's just relating to three Nova Scotia independent senators. I guess it was on June 7th, issued letters to yourself and Minister Fury and Minister Blair in Ottawa, requesting that you guys come up with a federal provincial announcement for this inquiry into the mass shooting. Where are we in terms of that announcement, and what are the conversations that need to happen to get that call? As they say, they're urging you guys to make that call as soon as possible.
Well, there's been ongoing conversations, and they continue with the Minister of Justice here in our province, Minister Fury, with Minister Blair nationally, to continue to ensure that all the players will be at the table as we continue to answer the questions and move towards answering the questions that Nova Scotians have about that particular day and the incidents around it and what led up to it.
Jesse, do you have a follow-up?
Thank you. This is for another colleague working on a story regarding the telehealthcare, Premier. I'm just wondering, we're hearing from people, using it and enjoying the experience. Is there a look to continue this telehealthcare program and roll it out in a more robust way?
So, we were following it, working with Doctors Nova Scotia, former President Dr. Ernst, who was leading the organization when we entered into this, was very optimistic about how it would work, very optimistic that physicians would enjoy it, but quite frankly, I don't think any of us fully appreciate how much Nova Scotians were going to like it. I've heard very positive feedback from Nova Scotians, and we'll continue to work with Doctors Nova Scotia to see what the future of this program and some of the other initiatives that we have rolled out will look like after we find our way through COVID.
Next question will go to CBC's Carolyn Ray.
Hi there. My first question is for Dr. Strang. You talked about planning for summer vacations and giving people time off. I'm just wondering about your own office. I can imagine you guys have been working really hard the last few months. Are there resources in place to kind of alleviate some of your workers so they can get a break and make sure they're supported?
So I'm starting that conversation with my team. I have a small team, and along with my colleagues in Nova Scotia Health Authority Public Health, we know there's a significant amount of work we have to do to sustain our epidemiology and actually, to have public health plans, to be prepared for wave 2. But at the same time, we have a lot of people who are very tired. So we're actively looking at how do we actually give people that rest, but still focused on the pieces of work which are absolutely critical to move forward. But thanks for asking.
And Carolyn, do you have a follow-up?
Yeah, this is for the Premier. We're hearing from a lot of people who are wondering when the business of government will start up again and things like Access Nova Scotia and driver's tests. Do you have a sense of when that might be back up and running, especially since now salons and restaurants are open?
I do. Thanks very much for the question. First of all, government has continued to be open in aspects of like every part of our society. There were restrictions obviously placed on how we interacted with the public, how the public service interacted with the public. Those restrictions, by and large, with Service Nova Scotia. People were grateful for the work that had happening, and the conversation has now started with how do we start opening up other centres across the province, not only Service Nova Scotia, but community services, for example. We'd require where clients would come in and meet. So that process is ongoing. Clerk has been working with their colleagues. We'll have more to say. They'll communicate that out to their employees in the coming week or two on how we safely start reopening up government. Bearing in mind, particularly here in some of our offices, there's hundreds of people in them. We need to make sure that we can do that as we follow the public health protocols and see how what a work week looks like in the sense of how many come in, do they come in on different days, those types of questions that they're working their way through. But government, like businesses, is starting to open up now.
Next question will go to Natasha Pace with CTV.
Thank you. Dr. Strang, last week when we spoke, I asked you about visitation to long-term care homes and when that could possibly start back up. And I think you mentioned you were hoping to make an announcement this week about what that could look like or when possibly people could visit loved ones in long-term care homes. Has anything been finalized?
So we're working at that. Today's only Tuesday, so there's 3 more days for the rest of the week. So we're working on it.
Do you have a follow-up, Natasha?
I do. I'm wondering about an Atlantic bubble. I know you've been asked about this before, Premier, and I'm wondering whether or not there's been any decision about whether or not there might be an Atlantic bubble or if Nova Scotia would be able to participate in that, considering we're going into the summer and the tourism season.
So we're, as I said, that's something that's obviously on our mind, but we're following the epidemiology. As Dr. Strang said in his opening remarks, the next couple of weeks are going to be critical for us. And then we'll make further decisions about how we open up our economy and potentially opening up the region. But I want to caution everyone, the epidemiology over the next couple of weeks will determine how quickly and how far we can go.
Next question will go to Stuart Peddle with the Chronicle Herald.
Thank you. I was wondering, the last couple of updates did not include the number of people who are still in hospital. Previously, there had been 3, I think, with 2 of those in ICU. Were those cases resolved, or were those part of the data that had not been integrated with the system?
Yeah, that's part of the data that we're just reconciling. So we'll get a comprehensive, full set of data tomorrow.
Stuart, do you have a follow-up?
Yes, I'm wondering about future environmental concerns as the economy opens up and more people are wearing face masks and protective gear. It seems that a lot of other places have seen quite an increase in those entering into the sewer systems as people are throwing them out inappropriately. Wondering what kind of mitigation efforts we may be seeing for that.
Well, it would be like any other product. You would dispose of it like you would with a product that you put in the garbage. If it's a recyclable product that is part of that, for example, some of the hand washing bottles that we'd be using, we'd recycle that. If it's part of our plexiglass, we do the same thing. I strongly encourage people not to create another problem, which is using it, putting it in the sewer system. There's a level of common sense associated with us having to deal with the issue of COVID and the products that we're going to use to protect ourselves and protect others. And I would always caution people to use the common sense rule and as we move forward.
I can also add to that, there's a number of local companies who are now manufacturing washable and reusable masks. So I would encourage, like everything else, reduce, reuse, recycle. If you can get a reusable, washable mask, and there's lots of them available, as I said, locally, I would encourage people to do that than to avoid having to use a one-time mask that you just throw away.
Next question will go to Lindsay Armstrong with All Nova Scotia.
Thank you. For the Premier, today Halifax's CAO said he's concerned that municipalities are being asked to make payments to the province for things like education based on pre-COVID budgets, despite schools being closed. Can you explain why the province is still requesting full payment and why contribution amounts haven't been adjusted to reflect the new economic reality?
We'll continue to work with our municipalities across the province. The reality of it is there is a portion of municipal funding that goes towards those important services to Nova Scotians. And we'll continue to work with the national government and our municipal partners to ensure that we work with some of the pressures that have been caused on municipalities through COVID.
Lindsay, do you have a follow-up?
Yes, thank you. With the emphasis placed on developing reopening plans, how has the government stepped up inspections to ensure compliance with those plans? Have you been told if there are any businesses that have not been compliant?
So we all along we've said certainly the inspection of businesses is going to be focused on existing compliance. So all businesses we have in labor and advanced education we have workplace health and safety inspectors who are continuing to do their work. We, as I said in my remarks, we have alcohol and gaming with they inspect bars and restaurants. We have public health inspectors who are also in restaurants. So we're using all those existing mechanisms. There was certainly an increased enforcement presence on the weekend, alcohol and gaming, and as I said, they were in dozens of restaurants and bars, and with very good results. So I mean that's an indication of how we allocate resources appropriately when and different times of the weeks and months to when there's a reopening or a resurgence. So but we are relying on existing kind of enforcement compliance mechanisms around reopening of businesses.
We're also relying on the continued support of Nova Scotians. Nova Scotians understand the importance of practicing good public health protocols. I fully have all the confidence in business owners and Nova Scotians as we start opening up the economy, as they start going out and enjoying some of the things that they haven't been able to do for months now. They will follow the advice of public health. It's not only important to the individual business, it's important to their own health. And I have every bit of confidence that Nova Scotians will continue to put other people's interests ahead of a short-term visit or expanding the bubble too soon. They will do what they've been doing, which is putting the collective interest of our province at the forefront, and I want to thank them for doing that.
Next question will go to Katie Hartai with News 95.7.
I'd just like to return to the temporary virtual medicine agreement with Doctors Nova Scotia. As far as I understand, this agreement expires at the end of this month. Are you looking to renew it at this time?
Yeah, I think it's the 30th. There was a number of measures put in. That conversation is ongoing. As I said to one of your colleagues earlier, Nova Scotians. I've heard from Nova Scotians who've enjoyed being able to access care that way, and that conversation will be ongoing with Doctors Nova Scotia, and we'll have more to say as we get closer to that date.
Katie, do you have a follow-up?
Okay, and it is a great time to vacation within Nova Scotia, but some people have immediate family just across the border. So you're talking about monitoring the epidemiology to determine when interprovincial travel will be allowed. What exactly are you looking for? No cases or just a few cases?
So I mean, we're clear that while we'd love to have no cases, we know that we have some tolerance of some level of COVID activity. So we're not going to base things only on having no cases. It's not just the number of cases. We're looking for are they clustered together? Do they indicate a large outbreak? What is the source of exposure of those cases? Are there indications that they're showing, that this leading into widespread community transmission? So it's more than just the number. And so, we will tolerate, a low level of numbers of cases, and we have to be realistic. In the coming weeks and months, we are going to see some sporadic cases here and there, but our goal is to keep it at that sporadic level, not have wide community or spread in any community, and certainly we're very vigilant about outbreaks in higher risk settings like long-term care facilities. And that is the discussion we're having across the country, the chief medical officers, about that same objective. We're all on the same page on that, and we're looking at that. I'm having conversations with my Atlantic chief MOH colleagues about how we could actually get to a place where we're comfortable with the our collective epidemiology, then put some things, some recommendations forward to our premiers.
Next question will go to Tim Biscay with the Halifax Examiner.
Hi, Dr. Strang. I was intrigued when you said that the death that was announced today, the person that died a few weeks ago, and it makes me wonder how Nova Scotia is attributing COVID deaths. I know that south of the border, it's all over the map from state to state. And is it that just anyone with the disease who dies, it's attributed to COVID, or is there some other measure?
No, it's actually ultimately the determination of the physician, who actually every death has to be certified by a physician. The vast majority of ones are very clear. Somebody has had a COVID infection, has severe disease, and it's very clear what the cause of death is. But this isn't the first time. We've had a handful of cases where we've had in-depth discussion with the clinicians. There may or may not be an autopsy involved, and we work together with public health, with one of the medical officers, the clinicians, and if necessary, one of the medical examiners, to really have an in-depth conversation about what actually was the cause of death. Because somebody could have a COVID infection that wasn't severe and die of a completely different cause. So where necessary, where there's some questions about that, we make sure that the right clinical people work together and come to a common diagnosis on the cause of death.
Tim, do you have a follow-up?
I do, for the Premier. Premier, you had said before, and I think you were pretty clear about it, I'm just asking for a bit more detail. When you said that you were notified on April 19th about the mass shooting that was then underway, I guess, can you elaborate and say what time you were told, who notified you, and what you were told at that point?
Yeah, I was notified in the morning. I don't exactly know what time it was. I said I heard it when I woke up, and then I just started making calls with internally. And at that point, there was limited information inside of government at all related to that incident.
Next question will go to Kyle Shaw with The Coast.
Hi, Chrissy. Thanks. Dr. Strang. Can you talk more about this panorama system, what it is? Are long-term care facilities already using it? Are doctors and hospitals already using it? I've never heard of it until it was in the news release yesterday, so I'm very curious.
So Panorama is a public health information system, so it's used by public health. So it's not for doctors, nurses outside of public health, and it's an information system where it's built on a number of modules. I guess one is it's how we track our vaccines and other biologicals. It's a case management tool. So as public health nurses follow up a whole range of notifiable diseases, all the information on the case and their contacts now is entered electronically. Now we have the lab, the notifiable diseases come in Panorama. So it really is, it brings public health into the modern age around having an electronic information system that we have, as opposed to a paper-based. A good example we have, and we're working all the vaccinations, school-based vaccinations that are delivered by public health. For the last 2 years, those have been entered now as we've implemented Panorama. Whereas previously we had, when I first came here to Nova Scotia, we had boxes and boxes of index cards and shoe boxes, and that was our immunization record. So that's an example of how we're actually now in the 21st century in information systems. And over time, as we build in the linkages to other data systems, our goal is to produce one component of this will be a robust immunization record, whether it's a public health, a family doctor, a pharmacist, or somewhere in the hospital. if somebody's vaccinated, all that through data linkages gets in when we have an immunization registry. But fundamentally, it is an information system for public health used by public health. It is the same information system which has been implemented in almost every other province and territory across the country.
Kyle, do you have a follow-up?
Yeah. So just further to that, sorry, I'm just trying to understand my understanding. Yeah. So the lab becomes part of Panorama. Then how does the information, if the long-term care facilities and doctors' offices aren't on it, like how does having the lab's information integrated help with the timing lags and inconsistencies we're seeing coming out of long-term care or other places?
What happens now, because we have a whole list of diseases, and COVID-19 is one where they're called a notifiable disease, where the lab is required to report those. Up until we integrated them, we had a separate lab information system where all those notifiable diseases that had to be reported to public health were reported in electronically, but it was a separate information system. Now we've been able to do the linkage, and it's the IT folks who understand this, to make sure that now that lab information doesn't go to its own information system. It automatically gets linked into and appears now in Panorama. So if we have a case of COVID-19, the epidemiologists look at that every day, but now a nurse can right away, if she's the one assigned to do a follow-up of a COVID-19 case, she goes right into Panorama and starts doing her case follow-up and entering all that information right into Panorama, and then we can extract information for epidemiologic purposes from Panorama. But because we've done this linkage, now Panorama is the single data system, and it's the sole source of truth around the epidemiology around COVID-19, and has removed some of those inconsistencies because different different information systems with different cutoff times for reporting, all those things that we've been talking about for weeks are removed, and Panorama becomes the single source and reliable source of epidemiologic information for COVID.
Next question will go to Bill Martin with Six Rivers News.
Thank you. A question for Dr. Strang. Doctor, there are a lot of kids and youth sports programs are chomping at the bit. I'm asking about baseball in particular, where many of our community complexes might have 1, 2, 3 or more ball fields, for example, and fenced off areas. Some are suggesting that every time you've got a fenced area, you have the opportunity of convening 10 people. Baseball Nova Scotia is suggesting that you can have 2 coaches and 8 participants and 1 parent for each of the kids involved as participants. There's confusion. Can you help clarify it, please?
So I think first of all, we need to look at what is the group. The group, I would say, is the number of 10, and each sport, I guess, each club figures out who makes up that 10. Is it not 10, all just 10 players participating, or is it 9 players and a coach? Anybody who's a spectator or observer is separate, and they have to be apart from that group of 10. So any spectators have to be maintaining social distance between the group and amongst themselves as well. As each sport is developing their own return to participation protocols, and I use that word as participation. You heard last week Soccer Nova Scotia said there's not going to be competition, so kids are going to be able to participate in sports, but it's going to be very much more based on various kind of skill development activities that they can do while maintaining the requirements on numbers and social distancing, and many sports are not going to be able to do what we would traditionally say is a competition. How the sports are working it out, we basically work with them to say every field, whether it's a field, a rink, a ball diamond, each of those can have a group of 10. But we've also, if they're big facilities, so I'll use the BMO Soccer Center as an example, because they're able to bring dividers down, and they actually can rent their space out, so you can have 3 different spaces within that one big field. And it makes sense that though they can actually have 3 groups of 10. So if there are big facilities that can break their space up and rent multiple components of that, we've said said, each of those components can have a group right now of 10. If it's just a single soccer field in a community, that can only have a number of 10. I know can be a bit confusing, but certainly the sport organizations are understanding what they can do. Our rec facilities are understanding what they can do. And as I said, all the sport organizations are continuing to work at their return to participation protocols.
Bill, do you have a follow-up?
Again, just to clarify, Dr. Strang, it sounds like you're saying the likelihood of actually playing games is going to be pretty limited, and that skill development and practice opportunity is what you're talking about.
That certainly team sports, especially team sports where there's a lot of physical contact, soccer, basketball, hockey, rugby. Baseball is a bit different. If there was some creativity, you could perhaps come up with ways you could have a baseball game while maintaining social distance. The sports are working on that, and I also know there's discussions at a national level. The national sport organizations are supporting each of the provinces and the provincial sport organizations. But you're right, a lot of sports, especially the team sport, is going to look very different this year. But that's not necessarily a bad thing. For young kids, the focus on sport should be on building skills, building teamwork, and less focus on competition.
And that's all the time that we have for questions today. Go ahead, Premier.
Thank you, Chrissy. I want to congratulate all the businesses across the province who opened their doors on Friday and welcome customers in over the weekend. Whether you hit a patio, got your hair cut, went to the gym, or did some shopping, people were out and about around our province. Thank you to the businesses who had the courage to open their doors and the customers who were kind enough to spend their dollars here. By all accounts, the first step in restarting went well. Everyone is following protocol, staying safe, and being respectful. To the business community, I understand this is not easy. You are not at full capacity, far from it. I appreciate your patience. You are the heart of our economy, and we need you. I understand some of you want us to move faster to get your businesses back to where they should be. We want them to be back where they should be too. But it is our hope that this approach of easing slowly into reopening will not only keep us healthy and safe, but will keep your doors open for the long term and allow your business to grow. The goal is to continue to open up, but that will depend on how well we manage this stage. So far, so good. It has never been more important to this province or in this province than now to help your local businesses. That means we need to think local, buy local, and support local.